From the shadows of the past to the lessons of today, this is Mr. Nord's history. Imagine this. You're a poor black farmer in 1930s Alabama. You've never seen a doctor in your life. You can barely afford food. Your children are hungry. Your body aches from working fields you'll never own. Then one day, a flyer appears in your town. Free medical care, free meals, free burial insurance. It sounds like a miracle, a gift from the government. Finally, someone who cares. So you sign up. You bring your friends, your neighbors. You had no way of knowing. You just signed your own death warrant. For the next 40 years, the United States government would watch you suffer, watch you go blind, watch you lose your mind, watch you die, and they would never give you the cure sitting in their pockets. This is the story of the Tuskegee Syphilis Study, the longest, most unethical medical experiment ever conducted on American soil. And as we step into 2026, this story is more important than ever because the wounds it created are still bleeding today. To understand this story, you need to understand where it happened. Macon County, Alabama, 1932. The Great Depression had America on its knees, but for the black sharecroppers of the Deep South, life had always been a depression. 82% of Macon County's population was African American. Most were descendants of enslaved people. Most worked land they would never own, trapped in a cycle of debt and poverty that stretched back generations. Medical care, a fantasy. Education, a privilege few could afford. These were people who had been abandoned by their country long before anyone with a clipboard showed up. But there was one bright spot, the Tuskegee Institute. Founded in 1881 by Booker T. Washington, it was one of the most prestigious black universities in America. A symbol of hope, a beacon of progress. The government would use that symbol to commit one of the greatest betrayals in medical history. In the late 1920s, the U.S. Public Health Service discovered something alarming. Macon County had one of the highest syphilis rates in the country. Nearly 40% of the black population was infected. Syphilis, a sexually transmitted disease caused by the bacteria Treponema pallidum. In its early stages, it causes painless sores, easy to miss, easy to ignore, but left untreated, syphilis is a monster. It destroys the heart. It eats away at bones. It invades the brain, causing madness, dementia, personality changes. It attacks the eyes, causing blindness, the ears, causing deafness, and in its final stage, it kills. The government saw these suffering people and had a choice to make. They could help them, treat them, save lives, or they could watch, study, document exactly how this disease destroys the human body when no one intervenes. They chose option 2. In 1932, Dr. Taliaferro Clark of the U.S. Public Health Service launched what would officially be called the Tuskegee Study of Untreated Syphilis in the Negro Male. The plan was simple and horrifying. Recruit black men with syphilis. Tell them they're receiving treatment. Give them nothing. Watch them deteriorate. Document everything until death, then autopsy. 600 men were recruited. 399 had syphilis. 201 were healthy controls. They were told they had bad blood, a local term for various ailments. They were promised free medical exams, free meals, and something that mattered deeply to impoverished families, $50 for burial expenses. They never knew they were part of an experiment. They never knew they had syphilis. They never knew that the treatments they received, aspirin, vitamins, mineral supplement, were worthless placebo. They trusted the government doctor. They trusted the nurses. They trusted the system. And here's where this story becomes even more painful. The government needed someone the men would trust, someone who looked like them, someone from their community. They found Eunice Rivers, a black public health nurse, educated at the Tuskegee Institute, respected, trusted, one of only 4 black public health nurses in the entire state of Alabama. For 40 years, Nurse Rivers would be the face of the study. She drove the men to their appointment. She handed out the useless pills. She held their hands. She attended their funeral. Whether she fully understood what she was participating in remains debated to this day, but her presence gave the study something it desperately needed: credibility. The men underwent blood tests, physical exams, and something far more sinister: spinal taps. To convince the men to submit to these painful, dangerous procedures, the government sent letters with a chilling title: Last Chance for Special Free Treatment. It wasn't treatment, it was data collection. The spinal taps were purely diagnostic, designed to measure how far the disease had spread into their nervous system. The study was supposed to last 6 to 9 months. It would continue for 40 years. In 1943, penicillin was proven to be a safe, effective cure for syphilis. One injection, that's all it took. The disease that had tormented humanity for centuries could now be stopped. The Tuskegee study didn't stop. The men were never told about penicillin. They were never offered treatment. In fact, the government went out of its way to ensure they never received it. During World War II, 256 of the study participants were drafted. At military induction centers, doctors discovered their syphilis and ordered treatment before they could serve. The Public Health Service intervened. They contacted the military. They provided lists of names. They ensured that these men, their test subjects, would not receive the cure. Let that sink in. The U.S. government actively prevented American citizens from receiving life-saving treatment so they could continue watching them die. It gets worse. When local health departments launched syphilis treatment programs in Macon County, the study administrators made sure their subjects couldn't participate. They were redirected, turned away, protected from the cure. For 25 more years after penicillin became available, the Tuskegee men suffered without treatment. They went blind, they went deaf, they lost their minds, they infected their wives, their children were born with congenital syphilis. By the time the study ended, at least 128 men had died from syphilis or its complication. 40 wives had been infected. 19 children were born with the disease, and not a single participant had ever been told the truth. But perhaps the most disturbing part? This wasn't a secret. The study published its findings in medical journals. 15 articles over 40 years. Other doctors read about it, discussed it, cited it in their own research, and no one, not one physician who read those papers, ever publicly questioned the ethics of what was being done. In 1966, a young epidemiologist named Peter Buxton walked into the lunchroom of a San Francisco public health clinic. He overheard colleagues discussing something strange. A doctor in Alabama had been berated by federal officials for treating a patient with penicillin. Buxton was confused. Why would anyone be criticized for curing a disease? He started asking questions. He requested files. What he discovered shook him to his core. Buxton was the son of Czech Jewish immigrants who had fled Nazi persecution. He knew what it looked like when governments treated human beings as disposable test subjects. He wrote a report comparing the Tuskegee study to the experiments conducted by Nazi doctors, experiments that had been condemned at the Nuremberg trials just 2 decades earlier. His superiors were not pleased. One colleague warned him, "I'll send your report up the line, but remember, I have a wife and kids. Please forget my name." Another called his report trash. For 6 years, Buxton fought within the system. He filed complaints. He attended meetings. He begged officials to end the study. They refused. The CDC, the Centers for Disease Control, defended the experiment. They argued that stopping now would waste decades of valuable data, so Buxton did something that would change history. In 1972, he leaked the story to journalist Gene Heller of the Associated Press. On July 25, 1972, the story broke. America learned the truth, and the nation was horrified. The public reaction was immediate and furious. Senator Ted Kennedy called congressional hearings. Witnesses testified. Documents were examined. The full scope of the atrocity became clear. In 1973, civil rights attorney Fred Gray, the same lawyer who had represented Rosa Parks, filed a class action lawsuit on behalf of the survivors. The government settled for $10 million. Living participants received $37,500 each. The estates of those who died received $15,000. $10 million for 40 years of suffering, for hundreds of destroyed lives, for a betrayal that defied comprehension, but money couldn't undo the damage. By 1972, only 74 of the original 399 syphilitic participants were still alive. Charles Pollard was one of them. He was 66 years old when he learned the truth. When asked about what the government had done, he said quietly, "They ought to have been ashamed of themselves. I wouldn't have done them like that." Herman Shaw was another survivor, a cotton farmer who had signed up in 1932 hoping for free health care. He was 30 years old when he joined the study. He was 90 when he finally received an apology. The study ended, but its effects were just beginning. In 1974, Congress passed the National Research Act, establishing new protections for human subjects in medical experiments. Institutional review boards became mandatory. Informed consent became law. The Tuskegee study didn't just expose a crime, it rewrote the rules of medical ethics in America. 25 years after the study ended, something remarkable happened. On May 16, 1997, 5 elderly black men were escorted into the East Room of the White House. Herman Shaw, Charlie Pollard, Carter Howard, Fred Simmons, Frederick Moss, the last survivors of the Tuskegee Syphilis Study. President Bill Clinton stood before them, before the nation, before history, and he said the words the United States government had never spoken. "What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry." Herman Shaw, 94 years old, was helped to the podium. He stood before the President of the United States and spoke. The wounds that were inflicted upon us cannot be undone, but I'm saddened today to think of those who did not survive and whose families will forever live with the knowledge that their death and suffering was preventable." Then he said something extraordinary. "In order for America to reach its full potential, we must truly be one America, black, red, white, together, trusting each other, caring for each other, and never allowing the kind of tragedy which has happened to us in the Tuskegee study to ever happen again." Herman Shaw died 2 years later in 1999. He was 97 years old. The last surviving participant, Ernest Hendon, passed away in 2004. Why am I telling you this story now, at the start of 2026? Because the Tuskegee study didn't just happen in the past, it's happening in the present, every single day. Studies show that the revelation of the Tuskegee experiment caused Black life expectancy to drop, not from disease, from mistrust. Black men, terrified of what doctors might do to them, stopped seeking medical care. That mistrust persists today. When COVID-19 vaccines became available, researchers found that Black Americans were significantly more hesitant than other groups. When asked why, many cited one word: Tuskegee. The government spent 40 years proving to Black Americans that they couldn't be trusted. That proof doesn't disappear with an apology. But here's what I want you to remember. This isn't just a Black story. This is an American story. This is a human story about what happens when we treat any group of people as less than human. The doctors who ran this study weren't monsters. They were educated men who convinced themselves that scientific progress justified human suffering, that the ends justified the means. They were wrong. No study is worth a human life. No data is more valuable than human dignity. No experiment is ethical if it requires deception, exploitation, and the deliberate denial of care. The men of the Tuskegee study were farmers, fathers, husbands, sons. They weren't test subjects, they were human beings. Men like Charlie Pollard, who worked his 66 acres of land until the day the truth found him. Men like Herman Shaw, who dreamed of being an engineer but stayed home to run the family farm. They trusted their government. Their government betrayed them. Today, a memorial stands at Tuskegee University. The National Center for Bioethics was established to ensure this never happens again. But memorials don't heal wounds. They just remind us where the wounds are. As we enter this new year, let the Tuskegee study be a reminder. Question authority, demand transparency, protect the vulnerable, and never forget that the most dangerous experiments are the ones conducted on people who have no voice. 600 men walked into a study they didn't understand. For 40 years, they trusted the wrong people. And when the truth finally came out, most of them were already gone. This was the Tuskegee Syphilis Study, America's darkest medical experiment, and a wound that still hasn't fully healed. If this story moved you, share it. The world needs to remember. Subscribe to Mr. Nord's History for more stories that shaped our world. And as we step into 2026, let's carry these lessons with us. Thank you for watching.